A very good morning to all. How are you this
Good
morning?
morning, doctor.
Waalaikumsalam. Good morning, doctor.
Salam, doctor.
Fine, doctor. How are you?
I'm fine here. I'm okay. Alhamdulillah. Dah breakfast dah semua?
Ya, doktor.
Dah Ada yang breakfast pukul 10 Ada yang breakfast lambat, ada yang breakfast awal. Okay, I will continue the lecture, yeah. So, we'll look at cephalosporin, yeah. Okay, right. Cephalosporin. Okay. The formulations. So I've mentioned earlier, there are like many generation of this group of drug. So let's look at the first generation. Examples of first generation of cephalosporin are cephalexin, yeah, cephadroxil. Yeah, I can't see the thing. Okay, never mind. Cephadroxil, cefalpyrin, cephalotin. Okay, so all these drugs, they are effective against gram-positive aerobes. Okay, they are used for bone and soft tissue infections. So usually they are given as prophylaxis. That means I've explained this before. Yeah, before the infection sets in, the doctors will prescribe this antibiotic. Okay, usually during a surgery or after a surgery. Yeah, a long-standing surgery. Yeah, they will we anticipate that there will be bacterial infection because the tissue has been exposed for a long time. So therefore, yeah, after the surgery, they will start on the antibiotics. Okay, so this is one formulation of a cephalexin. Yeah, it comes with the trade name of ufalexin. 500 means 500 milligram. So this is a human formulation. Yeah, can be used for animals. Okay. So the second generation is cefaclor, yeah, cefoxitin. So this one has broader spectrum of activity than that of the first generation of drugs. Yeah. So they are also effective against some gram-negative pathogens. Yeah, but not so common in veterinary practice. Okay, the third generation. Okay, this is common. Yeah, ceftriaxone. Yeah, ceftiofur, moxilactam. Yeah, so this generation. Yeah, they have extended spectrum of activity. Yeah, against gram-negative pathogens as well. Okay, especially the aerobes. So very effective against beta-lactamase. Yeah, the pathogens that produce the bacterial enzyme. So these are the one that causes resistance to drugs. Yeah, so not the bacteria, the enzyme. Yeah, the bacterial enzyme. So this is very effective. Yeah, against cephalosporinases and be able to penetrate the blood-brain barrier. Okay, it's used for gram-negative. Yeah, meningitis in small animals. Yeah, and the drug ceftiofur. Yeah, is a very useful drug for respiratory disease. Yeah, in cattle. Yeah, caused by pastorella species. Okay. So this is an example. Yeah. So whatever drugs that I show here, all these drugs are available in our hospital. So as I mentioned before, yeah, you must know, the drugs. There are many drugs, yeah, within one group of antibiotics, but you must know the drugs that are available, that commonly used and available in our hospital. So this one, yeah, it's 1 gram, yeah, for IV, yeah, intravenous injection, yeah, ceftriaxone, Yeah, this is a trade name, and then has got the diluent 10 ml of solvent. Okay, so you need to reconstitute with the water, yeah, for injection. Okay, so the adverse effects, yeah. So for each and every group of drug, yeah, antibiotics, yeah, you should also be aware of the adverse effect. You know the clinical indications, but you must have this in mind, yes, the adverse effects. Okay, so this drug can cause nephrotoxicity with prolonged administration. Okay, so at the normal dose regime, no problem. Okay, but if it's given like 3 weeks, 4 weeks, so it can lead to nephrotoxicity. So in patients that are suffering from renal disease, yeah, so the dosages should be adjusted. Okay, so besides that, yeah, similar adverse effect with the drug with the penicillin group of drugs, yeah, it can lead to hypersensitivity and allergy reaction. Okay, but if you don't have it, fine, okay, no problem. And okay, this is just a summary. So we go on to the next group of drug. Okay, we have looked at penicillin, cephalosporin, fluoroquinolones. Yeah, so now we look at fluoroquinolones. So as usual, the learning outcomes, yeah, very similar to other groups of drugs, other group of antibiotics. So fluoroquinolones, yeah, this is a very new group of antibiotics, yeah. So very promising antibacterials, yeah, in many years. So the first generation actually, yeah, is the nalidixic acid. Yeah, and this one only effective against gram-negative organism. Okay, so the latest generation, yeah, of this group is the fluorinated, yeah, derivatives, yeah. So the earlier group, yeah, the group name is quinolones. Okay, the nalidixic acid is the example of the first generation of quinolones. Okay, so I repeat again here. So the older generation is quinolones, yeah, and within the quinolone group, yeah, the first generation of drug is nalidixic acid. This is an example. Okay, so the latest generation is the fluoroquinolone. Okay, so it has got the fluorine ion attached to the quinolones, which is like has got broader spectrum of activity, yeah, as compared to the first generation of the quinolones. Okay, so in general, yeah, fluoroquinolones, yeah, they are effective against many gram-positive and gram-negative bacteria. Okay. So briefly, the kinetics of fluoroquinolone, yeah, absorbed well, yeah, following oral administration with high bioavailability. Okay, I'm not sure whether I've introduced this term when we were talking about the concepts and the principles of kinetics, yeah, but I would like to remind you again, yeah. So bioavailability, yeah, it refers to the rate and extent to which a drug administered, yeah, when the drug is given, yeah, enters the systemic circulation in unchanged form. That means it's not being metabolized before reaching the systemic circulation. All right. So I would say if a drug is given intravenous, the bioavailability is 100%. Do you agree with me?
Yes.
Yes. Yeah, sure. Because it goes direct into the system. Yeah. Once you give it intravenous, yeah, it is already in the circulation, systemic circulation. Yeah. So it doesn't have any metabolism or, first pass effect. There's none. Okay. So, but with oral, you might get first pass effect. But with this drug, even after oral administration, the bioavailability is high. Okay. So distributed in most tissues of the body. Okay. Elimination, excreted by the kidney. And dosages need to be adjusted for patients with kidney failure. Okay. So brief mechanism of action of fluoroquinolones. The examples first. So within this group we have enrofloxacin and ciprofloxacin. Okay. So mechanism of action. The drug interferes with the DNA gyrase. So DNA gyrase is an enzyme, in the bacterial cell, which when this is interfered, there will be disruption of the formation of the DNA of the bacterial cell. Okay, so this will lead to the death of the bacterial cell. Okay, therefore, and the bacteria will be killed, okay, because when there's no DNA, will die, and the effect is bactericidal effect. Okay, so in some cases, enrofloxacin, after giving enrofloxacin, it converts to its active metabolite, which is ciprofloxacin. Okay. Sometimes, when people detect antibiotic, when they do like surveillance study, and then they take samples, in the meat samples, and they detect enrofloxacin, and they will also detect ciprofloxacin at the same time. So this does not mean that the animal has been given enrofloxacin and the ciprofloxacin. The enrofloxacin is being converted to its active metabolite, which is ciprofloxacin. Okay, but drugs are also available as enro and ciprofloxacin. Okay, is that clear? Boleh ke, Mira?
Boleh, boleh.
Boleh ya?
Boleh doktor, boleh.
Okay, right. Sebab itulah saya, when I give in class, so I see the expression, the face expression of the students. So tahulah faham ke tak kan. So bila ni tengok computer screen aja macam rasa pelik lah. But never mind, I will just carry on. So please stop me if you don't understand at any point. Spectrum of activity, okay, most active, of the fluoroquinolones against gram-negative aerobic bacteria, right? So only effective against certain staphylococcal gram-positive bacteria, So this is a very important point, ineffective. So if there is an anaerobic gram-positive bacteria, then this drug won't be effective. So the spectrum of activity of each antibiotic is very important. Okay, whether it's bactericidal or static, that is a different matter. Okay, it's according to how it acts on the bacteria organism lah. But what is important when you want to select an antibiotic, the spectrum of activity is important. If you choose the wrong one, the treatment, the treatment won't work, and the animal will die of infection. Okay, so drugs, okay, I've mentioned here. So they are for dermal, respiratory, urinary tract infections, most commonly used in cats and dogs. Okay, even the licensing, of this product is to be used in small animal, cats and dogs. effective against many beta-lactamase producing pathogens, yeah, such as Staphylococcus, yeah, Pseudomonas, yeah, E. coli and others. So this is an example of enrofloxacin. So the company that produces enrofloxacin is Bayer, okay, with the trade name Bayerocin, yeah. Okay, it comes in 50 milligram and 150 milligram tablet. Okay, this is injectable form, yeah. So we have 0.5% and 5%, yeah. It's registered as Baytril, yeah. Then the active ingredient is enrofloxacin, okay, right. But this is very common. When they say Baytril, people will know it's enrofloxacin. And so this is the reason why I emphasize that, you should know how to calculate, when they give in percentages, right? So here is in percentage, so you must know how many milligram per ml. Okay, so there are different formulations, yeah, like 0.5, yeah. So the concentration is less as compared to 5. Okay, 5 is for bigger animals. Okay, this are for piglets. So the adverse effects, yeah, so this drug is extremely well tolerated. So the common side effects, like with any drug, yeah, sometimes you have like nausea, slight vomiting and diarrhea, because the antibiotics can disturb the normal flora, yeah, in the gut. So that's why it leads to diarrhea, yeah, and occasionally skin rash, but not so severe, all this. This one could be detrimental, yeah. So it can cause damage to growing cartilages. Okay, so therefore in human, yeah. So this drug is not recommended for people who are less than 18 years old, and whereas in the dogs, yeah, it is not given, yeah, to small and medium breeds for the first 8 months, yeah, but to large breeds for at least 18 months they don't prescribe fluoroquinolone because these animals are still growing, yeah? And in the cats, yeah, it can lead to retinal damage, yeah, so therefore the dose is reduced. So examples, yeah, of besides Baytril, yeah, drug, yeah, as I mentioned earlier, that we have also Marbosil, yeah, Marbosil, 200 milligram, yeah, 20 milligram and 5 milligram. Okay, so it contains, yeah, Marbosil is the trade name. It contains marbofloxacin. Can you see the spelling here? Yeah, marbo, yeah, marbo, floxacin, floxacine, marbofloxacin. Okay, so this is from a French company, metaquinone. Okay, so they have different formulations because we have animals weighing from as from grams to kilograms, so the weight of the animal varies, so that's why we have different formulations. Okay, so in a nutshell, yeah, fluoroquinolones should be used as second line drugs, okay, because these are the new group of drugs, yeah. So the first liners, yeah, would be the penicillins, yeah, first generation of cephalosporin, tetracycline, yeah, sulfonamide and sulfonamide trimethoprim in combination. So only like if the animal has developed resistance or the treatment is not working, then you switch to fluoroquinolones. Okay. Okay, this is okay, right. So now we'll look at tetracycline. So this is another group of antibiotic that you must know. It's a very common drug, yeah. So let me share the document. Hey, yeah. Okay, hang on a minute. Let me close this document and share the new. Okay, so I won't go through the learning outcome. Yeah, it's the same. Okay, let's look at tetracycline. Yeah, so tetracycline is an amphoteric compound. Yeah, so this they are capable of acting as an acid or a base. Yeah, according to the environment. Yeah, where they're acting on. So the mechanism of action. Yeah, it's a bacteriostatic drug. Okay, it inhibits the bacterial protein synthesis by binding to the 30S ribosome. Okay, so here there are many drugs that act on the bacterial protein, but at different sites. So this is very important to know where it binds at the ribosome. Okay, because some binds at 50S ribosome. So different sites here will have different effect. So this one binds to 30S ribosome. Okay, and it prevents the attachment of tRNA, yeah, to mRNA of the ribosome complex, yeah. Therefore, inhibiting the addition, yeah, of the amino acids to the growing to the peptide chain, lah. Okay. So spectrum of activity, yeah. So this drug, even though it's a bacteriostatic drug, it has got a very large spectrum of activity. Yeah, it is it's effective against gram-positive and gram-negative aerobes and anaerobes. Okay, rickettsia, yeah, spirochete, chlamydia, mycoplasma, protozoa. So therefore, if the cat or a dog has mixed infection, yeah, so this drug would be the drug of choice. So the kinetics, yeah, absorption variable, yeah, it depends on the specific drug. Okay, later on we'll look at this drug, yeah. So the distribution, yeah, distributed to most tissues, low levels, yeah, it has low levels in CNS. It crosses the placenta and excreted in the milk and binds to calcium. Okay, so therefore, can we give this drug, yeah, to a pregnant doe or pregnant animal? Anyone?
No, because it will cross the placenta.
Yeah, yeah, goes to the placenta, yeah, and it also interferes. So, what is the defect? Yeah, when it crosses the placenta, it interferes with the formation of long bones in fetus. Okay, so therefore, this drug, yeah, shouldn't be given to animals that are pregnant. Okay. So even in lactating animals, yeah, so tetracycline, yeah, should not be administered, right? Okay, and then the elimination, yeah. So there are some of the drugs, yeah, they are excreted unchanged in urine, yeah. Therefore, it produces some toxic effect, yeah, to the renal tubules. Whereas the others, so it's not like general, some in excreted unchanged in urine, and some are metabolized by the liver, yeah, excreted in the bile, yeah, and being eliminated in feces. Okay, so please bear in mind the elimination, some in urine and some via feces. So preparation, yeah, and the therapeutic uses, okay. The tetracycline, yeah. So the group name is tetracycline, okay. Within the group, yeah, we have drugs, yeah. So one of the example of the drug, yeah, of tetracycline group is tetracycline, yeah, the name, yeah? And chlortetracycline and oxytetracycline. Okay, so Oxytet, yeah, they commonly referred as Oxytet, yeah. So Oxytet, we have different formulation, long acting and short acting. Okay, so in animals like large animals, yeah, usually the long acting oxytetracycline is preferred so that you don't have to give frequent injections or frequent medication to the animals. So they are very effective against local and systemic bacterial. Yeah. So as I mentioned, the spectrum of activity is broad. No? If there's chlamydia or rickettsia or any protozoal infection, yeah, in cattle, sheep, horses, and swine. Okay. So the other group would be the doxycycline, yeah, and also tetracycline. Yeah. So this one, yeah, they are used for they are used in cats and dogs. Okay, to treat respiratory and urinary tract infections. And other diseases like Lyme disease or Brucella infection caused by Brucella species, Bartonella, and Ehrlichia species. Okay, uh, we usually we refer this as E. canis. Yeah, this is a protozoal disease. So examples, yeah, as I mentioned, yeah, doxycycline. This is a 50 milligram, yeah. So it's in the tablet form, okay, for cats and dogs. Okay, doxycycline. Okay, this is 100 milligram. Okay, this is a human formulation, but as I mentioned, can be used, yeah, for animals too. Okay, the adverse effects. Okay, so all except doxycycline are potentially nephrotoxic. Okay, so only doxycycline, yeah, the drug is eliminated via feces. Okay, it goes through into the liver and goes into the bile. Yeah, as you can recall, last time I've showed you the elimination process, how it happens. There are a few mechanisms. Yeah, kidney, renal. Kidney is the main, followed by liver. Okay, so here the doxycycline, yeah, it is being eliminated, yeah, uh, in feces, whereas the others are in urine. Okay, right? So therefore, doxycycline. That's why doxycycline is safer as compared to the other drugs of the group. Okay, so the others can cause nephrotoxicity because it's being excreted, yeah, in the urine, yeah, the unchanged form. Yeah, it can induce those related changes in the renal tubules. Yeah, so this problem can be exacerbated, yeah, by dehydration. Yeah, if the animal is not drinking and eating, yeah, so please you have to take some precaution, lah. Okay, yeah, either you put the animal on drips, yeah, and then start the medication. Yeah, so usually lah with animals that are dehydrated, yeah, we will that means dehydrated, it's not a good news. Yeah, so usually they're admitted, and the first thing that we do, yeah, in a clinic is to start them on drips. Okay, normal saline, yeah, and later on normal saline is 0.9% of natrium chloride. Yeah, so start on drips, then only the medication will go in. Okay, so it can also cause hemoglobinuria, toxemia, and so on. Okay. Otherwise, it's a safe drug. No problem if it's being like followed accordingly. And usually this nephrotoxicity occurs if it's given for a long time, 3 weeks, 4 weeks, and so on. So you must carefully monitor the patient. Otherwise, if the treatment is like 5 to 7 days, no problem. Okay, the other adverse effects, yeah, on the bones and teeth, yeah. So it binds to the calcium, yeah, deposit in newly formed bones and teeth due to formation. Okay, it also forms the cyclin calcium phosphorus complex in the in the enamel and dentine, yeah, of the teeth. Okay, so that's why it's not given in the young and growing animals lah. Okay, if their teeth are erupting, yeah, so it will affect the process of teething in animals. It can cause discoloration of the teeth, yeah. So there is a difference if you look at the teeth that animals that has been treated at a very early age and for a long time. The color will be like very yellowish. Yellow is common color, but you can compare, those even in humans, yeah, those has been on this tetracycline, yeah, for some serious illness, yeah, the color of the teeth, yeah, it's very yellowish. Impair long bone formation, yeah. So I mentioned earlier, yeah, it shouldn't be given in pregnant animals, yeah, because it affects the fetus. Okay. So infections of fungi, yeast, or resistant bacteria may occur, yeah, in the gastrointestinal tract with prolonged administration. It's given at the normal dosage regime and the time interval, which is like not time interval, the period, yeah, the treatment period, like 7 days, yeah, 14 days, no problem. So oral therapeutic doses may disrupt the ruminal microflora, yeah, in adult ruminants, because the ruminants are dependent, yeah, on the microflora for digestion, and also same goes to the horse. The colon plays an important role for the colon is like a secondary stomach for horses, yeah. Okay, so this is just the summary, and yeah, I will just, I think I've completed with this tetracycline. Any questions so far? Okay, I will move on to very briefly on this lymphocytes and lymphocytes, like, yeah, because macrolides and lymphocytes. Lymphocytes are very important. Small animal, yes, yeah, because of the broad spectrum of activity. Okay, where is it? Right. So I'll go through very fast on this, but they are equally important. So macrolides. Okay, so this, I will skip this slide. Yeah. So macrolides, they are weak base, yeah, with moderate to high lipophilicity, yeah. So at low doses, they are bacteriostatic, yeah, and with high doses, they're cidal. Mechanism of action, yeah, they also act at the protein, yeah, synthesis, inhibit the protein synthesis, but they bind to the 50S ribosome unit. Okay, 50S ribosome unit. Spectrum of activity, yeah, it's gram positive, aerobes, anaerobes, and mycoplasma. Okay, so it has got a broad spectrum. So very useful as penicillin substitute in penicillin allergic individuals. Yeah. So those who are allergic to penicillin, so this would be the drug of choice. So on the kinetics, yeah, it can be destroyed by the stomach acid. Therefore, all the tablets are enteric coated, right? Food may interfere, yeah, with the absorption of the drug. Distribution, it is being distributed to most tissues except the CNS. So mainly excreted in bowel. Okay. So drugs within this group are erythromycin. Yeah, you must know because this is a very common drug. Yeah. So it is effective, yeah, against gram-positive aerobes and anaerobes, yeah, okay, in cats, dogs, and horses, and very effective, yeah. The clinical indication, it's used for enteritis, yeah, caused by very specific organism, Campylobacter jejuni in dogs and foals, and also for Rhodococcus equi in foals. Okay. Tylosin, yeah, you have heard a lot of this drug, tylosin, being used in swine, in the sheep and cattle, yeah. So they are used for mycoplasma, yeah. Even in the poultry, yes, it's a common drug in poultry too, yeah, for mycoplasma infection, yeah. And then also for gram-positive bacteria and gram-negative pathogens, yeah, such as the Haemophilus and Pasteurella species. So in dogs and cats, yeah, for chronic colitis. Tilmicocin, okay, so this is a drug for, especially for cattle, yeah, it's being licensed for cattle for the use for infection caused by Pasteurella species. Okay, so the adverse effects, they are very mild. Okay, so this is like mild GIT upset, yeah, and then this is common lah. This is very common with any other drugs. Pain and irritation at the site if it's given intramuscular. Okay, may lead to diarrhea and so on. Okay, and then tilmicocin, local tissue irritation may occur. Yeah, edema can be noted. So all these are very mild signs like adverse effects. Okay, of macrolide. Now we go on to lyncosamides. Okay, lyncosamides, yeah, equally important. Okay, because this drug is commonly used in small animal practice. So within the group we have lincomycin and clindamycin. Yeah, so the drug that is available in our hospital is clindamycin. Okay, please remember when you go to final year, don't say Dr. Arifah didn't teach anything on lyncosamides, because whenever I get feedback from the clinicians, yeah, when you go to for final year, I guess, final year or fourth year, get feedback from Dr. Lau saying that students doesn't know calculation, forget everything. So I also don't know how to make you remember. So things that, the one common, I'm not asking you to remember the whole lot, but at least what we have in our hospital. So the mechanism is same, very similar. It binds to 50S ribosome. So tetracycline binds to which site of the ribosome? Anyone?
30S
You know,
ribosome.
30S, yes, good. 30S. So different sites. So whereas lincosamide and macrolide at the same site. So therefore, it shouldn't be given. Yeah, these two drugs. Yeah, cannot be given at the same time. Yeah, this will enhance the toxicity of the drug. Okay, because it binds at the same site. So that's why the mechanism of action is equally important. If you know this, then only you won't give, lincosamides and macrolide together. Or else if you prescribe that too, and then you can end up with toxicity. Yeah. Okay, so the bacteriostatic drug. Okay, right. So spectrum of activity. Okay, broader spectrum of activity of macrolide. Macrolide was only mycoplasma and gram-positive aerobes and anaerobes, whereas this is also effective against toxoplasma species. Okay. So preparation and therapeutic uses, yeah, listed here, yeah, lincomycin is in swine, yeah, for swine dysentery, it's a disease, yeah, in swine, to treat staphylococcal, yeah, streptococcal and mycoplasma infections. So clindamycin, okay, this one, as I mentioned, we have it, yeah, in our hospital, used in cats and dogs, yeah, for periodontal disease, yeah, osteomyelitis, dermatitis, deep soft tissue infections, yeah, by gram-positive pathogens and toxoplasmosis, yeah. So this is common, toxoplasmosis in cats and so on. So this would be the drug of choice. Periodontal disease. What is periodontal disease? Anyone? Raja, what is periodontal disease, Raja?
I'm not sure, doctor. Maybe it's something to do with the teeth. I don't know.
Yeah. It's peri is
Gum
around.
disease.
Yes, good. Who's that? Who spoke just now?
Me, Dr. Alia.
Alia. Okay, Alia. Right. So I cannot see your face, but yeah, I know your name. Okay, so yes, correct. She said it's gum disease. Yeah. So it's surrounding area peri, yeah, periodontal, yeah, surrounding around the teeth, yeah. Dontal, yeah, is referring to dental. So periodontal is gum disease around the teeth, yeah, infection. Usually in cats, yeah, we get a lot of periodontal disease in cats. Okay, the adverse effects, yeah. Okay, this is not relevant to small animals. So it's okay, no problem. So in horses, because it affects the microflora, yeah. It also kills the normal microflora in the colon. Okay. Right, so these are the formulations that we have, yeah, with the trade name of clinacin. Okay, different formulation 25, 150, and 75. Okay, so contains clindamycin. So this is according to their body weight lah. Okay, cats and dogs. Okay. So please bear in mind that both macrolides and glucosamides, they act on the same ribosome unit. Yeah. Okay, so that's with this lincosamides and macrolide. So I will briefly go into anti-parasitic drug. So just introduce and the details. I think we have like about 5 minutes. I think I can just introduce the anti-parasitic drug. Yeah. So how's the lecture so far? Any questions?
Doctor, I have a question.
Yes.
Um, since you have been studying this drug so far, most of it is excreted in the urine. So I was wondering, like, if these drugs are excreted in the urine, would we be observing a higher specific gravity in the urine of that particular patient?
Not necessary, yeah. Hang on a minute. Let me just open up this. Sekejap, sekejap I troubleshoot. Just complete this. Okay. Then does it appear? Okay, so no, you don't have to check the urine all the time, but if the animal has got urinary problem, sometimes when the animal is admitted to the hospital, we will do a complete blood profile, blood profile, check the blood, and then we will check hemogram, and then also the clinical biochemistry, do all the respective tests. Liver test, liver enzyme, and then the kidney function test and all those. Yeah. So if the animal is not suffering from any kidney disease, no problem. And as long as when you give drugs, the animal is drinking and eating well, But if it's sick, usually sick animals, they're not eating, no problem. But if it's not drinking, then it's a problem. Okay, so it must be on drips until it is being able to drink by itself. Because the elimination of drugs is via kidney. Okay, so if it's not drinking and it's not being eliminated, then it will cause it will cause damage to the renal tubules. Yeah. Did I answer your question? Who's that just now?
Raja, doctor.
Raja.
Yes, doctor, you answered the question. Thank you.
Answer? Okay. Right. So, okay, we'll just introduce this drug, and then we will go into the details after your break lah. Next week it's your break. Okay, so this one, the learning outcomes, is the as usual, I would like to know, I will ask the students, usually, to list some of the common external and internal antiparasitic drugs. Yeah, definitely I will ask, Okay, so I'm not going to ask, as I told you, I'm not going to ask the 20, 30 drugs that are available, in the market, no. But what are the common drugs, at least being used in the hospital? So, and then the principles, of the antiparasitic use, and lastly would be the mechanism of action, clinical indication, and adverse effects. So when I ask the mechanism, I'm not very asking you very detailed, until the cellular level, no. Usually that for masters and PhD that they have to know, but it's just a very brief mechanism of action. So let's look at the principles of antiparasitic use. So, okay, number one, students should understand the features, the features of parasites' life cycle. Okay, as you know, parasites, they have like arrested development, which means like slowed metabolism or larva migration. Okay, and then the adult worm. Okay, usually larva, they will migrate anywhere in the body. Then they will then only eventually this larvae, they will migrate to apa ni to the intestine, and that's where they mature to be adult worms. Okay, so therefore we need to know the life cycle, because usually okay, you give a treatment on day one. Okay, you know that this parasite, the larva migrates in the body, and usually these drugs will only eliminate the parasites in the intestine. Okay, so all the adult parasites will get killed, right? So when the larvae mature, yeah, and then it moves to the intestine, then you will have, yeah, you have to administer the second dose of the anthelmintic. Okay, usually like one treatment is not will not be enough. Okay, that's why you have to understand the apa ni, the stages, yeah, the life cycle of the parasite. At what time, after how many days, the larvae will apa ni, develop into adult worm in the intestine. So you need to repeat the treatment. Okay. So as I said, yeah, with parasites, there's no single treatment. Okay, you come and then you take a treatment day one and that's it. No. Okay, it'll be like a few treatments after that. Okay, and that's about the life cycle. Yeah? That's why the life cycle of the parasite is important. All right. And then the second principle would be on client education. So here we are dependent a lot on the client, because like parasitic infections, you cannot get rid like overnight. Yeah. So you have to like give treatment for a few weeks, and usually they are not warded unless it's severe infestation. But otherwise, they come as well, they will come and then get the medication, and the clients are the people who will administer the drugs to the patient at home. So the client must understand the reasons for additional controls at home, yeah, including collection and disposal of feces, because as we know, like parasites, internal parasites, how they are transmitted is usually through the feces. Yeah, they have to keep clean. Yeah, so that the thing doesn't reoccur, and repeated treatments are required. Yeah, and also treatment of other animals. So if the owner comes, he claims that only one cat is having that problem. Yeah, diarrhea and or having any lice infestation, but you have to advise, the client to treat the other animals in the house. Okay, so as you know, this cats or dogs, they have very close contact with the other animals and also with the client. So therefore, cleanliness is very important. And then medication should be given according to the instruction. Okay, right. So that's about the client education, to educate the client. And the next one would be the safe and effectiveness. So these compounds, they're very potent, especially compounds that are given for external parasites, such as ticks, lice, or what they call another thing, flea. Flea is very common in the cat. So they should only kill the parasites, without producing any toxic effect in the animal host. So this is referred as selective toxicity. Okay, selective toxicity means, the compound, is only act on the parasite and should not have any effect on the host tissue or the person who is applying or administering the product. Okay, selectively on the parasite. So if it has effect on the host will die too. Yeah, right. So you don't want to kill the host, right? So that's with parasite. And the next point is caution use in old, young, debilitated means sick animals or pregnant animals. Yeah, because of the ability for them to metabolize and excrete the drug, is compromised. Yeah. So because they don't fall in the normal group, yeah, of patients. So as I mentioned last time, like breed of apa ni, breed of dogs, okay, have you must be careful, like collies, yeah, they are high risk group, yeah, with ivermectin. I think I've mentioned this before. Yeah? So ivermectin is usually used for heartworm prevention in dogs, yeah. But these collies are very sensitive to ivermectin because they harbor a mutation gene, yeah, which is the MDR, multi drug resistant 1 gene, yeah, that can lead to toxicity, right? So in other dogs, no problem. Other breed of dogs, no problem. But in collies, you must be extra careful. Okay. Yeah. I think I will stop here. It's 10 o'clock, 10:05. Some, I think ada yang ada kelas lah. Yang the other groups, maybe your cohort, you all are free, but the others, in the group 3, I think they have a class after 10 o'clock. Right, I'll stop here. I will continue with my lecture after the break. Yeah, all this I will explain and I will show these pictures later on. Any questions so far? So I'll show you later on, the drugs, the parasitic drugs that are commonly available in our hospital, yeah, so that you can stick into your mind. And when you go to final year, okay, you say, yes, Dr. Arifah has taught me this. So please do not embarrass me. Okay, so far so good.
Okay, doctor.
Yes, doctor.
Yes. So all having semester break. So no difference. Semester break pun duduk rumah lah. I think you all cannot travel until the end of the year. You all have to stay at home. You cannot cross the border. You can go to your friend's house lah. Go for go to Raja's house for Deepavali. Deepavali is ni dah habis dah kan. Where are you staying, Raja?
I'm staying in Sentul, KL, doctor.
I see. You're a KL boy. Okay. Right. Any questions so far? You all can on your webcam. No problem. Okay. I haven't got. Any questions? Nothing from the class? All are good?
For me, okay, doctor.
Okay, Mira is the one who always answer me. Okay, since Mira has said nothing from her, so I assume that nothing from the class. So I shall see you after the break. Have a nice break, yeah? Bye, everyone.
Thank you, doctor.
Bye-bye. See you.
Okay then.
Thank you, Raja.
All right.
Thank you so much, doctor.